When will COVID-19 peak here? It's a question many of you have been asking and wondering, and now a new projection forecast when we could see the peak. Turns out it's next week. Our Shira Matsuzawa has been studying those projections all day. She's here to break it down for us. This is interesting, Shira.
Yeah, Mark, you know, that data is from the University of Washington's Institute for Health Metrics and Evaluation, or IHME, and they're the same projections the White House Coronavirus Task Force has been using. They're broken down by state, but for our purposes, we're only going to look at Idaho. But before we break down those numbers, I want to stress that this projection is only based on whether everyone continues to practice social distancing. New projections from the Institute for Health Metrics and Evaluation show Idaho will hit the peak for coronavirus deaths on April 16th. With 3 deaths expected that day. The peak for resources used happening 2 days prior on April 14th. The forecast is reassuring, though, stating Idaho is more than prepared to handle the demand, with the state expected to have more than 1,800 hospital beds and 150 ICU beds available for patients on that date. That's hundreds more than the amount needed. According to the data, Idaho will not experience any shortages when it comes to beds. But the study also shines a light on the number of expected deaths total, which they say will reach 57 by August 14th. The model takes into account the stay-at-home order, the closures of Idaho schools and non-essential businesses, and the limits on travel. If those restrictions are lifted or if people do not adhere to them, the Idaho COVID-19 numbers could shift. And within the last 90 minutes or so, the Idaho Department of Health and Welfare sent me a statement about these projections. In part, it says models are tools public health professionals use to run scenarios. Predictions and forecasts change as the inputs do. The governor's work group is still working with several universities on a model that's different from the IHME model. In the meantime, it's still too early to tell if Idaho is flattening the curve, but the lower numbers in recent days are encouraging. We really need all Idahoans to stay the course and follow the recommendations and stay home as much as possible. As for these projection numbers, if you compare them to the United States as a whole, Idaho is currently better positioned to combat the coronavirus than others. But it's important to note that the figures are being updated constantly and can change drastically depending on the measures states take. To see an entire breakdown of the projections, check out ktv.com. Mark?
And this is really interesting. Those that watched the news at 4 remember last week when we had Elke Shaw Tulloch, the administrator for Idaho's Public Health Department, on, and she was looking at that same model with the results that they had just released the day before. And at that time, it was mid to late May. Did they give you any idea on why that drastically got moved up? Any idea at all?
You know, Mark, I reached out to the Idaho Department of Health and Welfare, have not heard back yet about that specific question. However, as we mentioned, these models are constantly being updated by data, and so it's constantly evolving and changing, and so we'll just have to wait and see what, you know, day by day how this goes. But the best thing you can do right now is social distance yourself and, you know, wash your hands.
Yeah, there is a glimmer of hope if we can get to the other side of that peak before the month of May.
Right.